Hello everyone, welcome to the Totally Well Show. I'm your host, Joyce Strong. The Totally Well Show is a place where we get curious, ask questions, and explore everything to do with health, wellness, fitness, and all the things it takes to help you live the highest quality, most fulfilling life. I have my guest, Falguni Vashi, and I want to spell it for you, F-A-L-G-U-N-I, Falguni Vashi, V-A-S-H-I. And Falguni, welcome.
Thank you.
Falguni is a pelvic health specialist, and you can find her at pelviccurephysicaltherapy.com. She has a Facebook group. She's on Instagram, pelvicure.pt, and on LinkedIn. So she's actually a physical therapist who has created a niche and specialty in pelvic health. And I've always wanted to find someone like you as a mother of 5 children. Believe me, this has been of interest to me for a long time. So welcome. Tell me more about, well, first of all, tell me about you.
I'm very grateful and thankful that I'm here. So thank you for inviting me over.
You have kids?
I have kids. Yeah. I'm married. I have 3 children. My daughter is 11 and I have twin boys who are 7. So my hands are really very full.
Yeah.
And it being summer, it's even more crazy. But such is life.
Thank you for making the time to come.
My pleasure. My pleasure. So I have been a physical therapist for over 19 years. And in the last few years, I've gotten into pelvic health. And the way it works is that we all go to PT school, we get our PT degrees, and then some people like myself go and get more training to treat pelvic floor muscles. And essentially the reason why we treat all of this is because in the pelvic region there are bones and there are muscles. So some of the pelvic floor issues can be related to musculoskeletal issues. And I'm just going to name a few pelvic floor conditions that I can treat. So I can treat, I'm going to say first that I treat men, I treat women, I treat children, and any other gender that walks in my door. I treat urinary incontinence, I treat fecal incontinence, pelvic pain, prolapse, abdominal pain, any kind of urgency, frequency, prostate issues, anything under the belt, you name it, and I treat it.
Wonderful, wonderful. So do people come in with a diagnosis already so I have had the pleasure of seeing a urogynecologist, which is not a gynecologist who dresses really snappy.
Yes, yes.
But so they had some specific testing. Do you do that kind of testing, or do they come?
So I don't do the specific testing that the urogynecologists do because I'm not a doctor. But if someone comes in and says to me, oh, I've had 4 kids and, I just feel like something's there and, I feel the pelvic pressure and it doesn't feel right. I can go in and do an exam, and if they have prolapse, I can tell them that I think you might have prolapse. Now, am I treating the actual pelvic organ prolapse? No, but I'm treating the symptoms of the pelvic organ prolapse. So the pelvic pressure, the vaginal bulging, at the end of the day, oh my God, it feels so heavy. Every time I wipe, I feel something there.
Just to be clear, because I'm an RN, so I'm getting kind of this vibe. Because I'm an RN, because you're licensed, I'm licensed, you're a physical therapist licensed, there are certain things we can say and do, even though we may have in our head that we're fairly confident that we know what we're looking at here, but we can't diagnose. We can't do a medical diagnosis. So that's where that hedging is coming from.
Yes,
got it. Yeah.
Right. And so say if I think that their medical diagnosis might be this, I can't tell them that this is your diagnosis, but I can say that, okay, you have pelvic floor muscle weakness or tightness, and due to that you're feeling all these symptoms. And to confirm the diagnosis, I can send them to a gynecologist, a urogynecologist, and so forth. I always say to the patients or the clients that I see, I don't treat a diagnosis, I treat the symptoms and I treat the human being as a whole. And that's my one of my biggest goals, because I frequently get, well, is my organ prolapse going to get better? The reality is that once you have children, the anatomy in the pelvic region changes.
It's never the same.
It's never the same. So if a clinician says to you that, oh, I'm going to fix it, I would take it with a grain of salt, unless they're a surgeon and they tuck it up all there, which again is not the best solution to do anyway. That makes sense?
It does, yeah, yeah, yeah. So, wow, that's a lot of information, and I'm already like some things I didn't realize about what you do. So let me take it a little bit step back. You work in an office, physically in an office in Nashua?
Yes, I'm located I'm an independent provider. I have my own private practice, but I'm located in the New Hampshire Health and Wellness Center in Nashua, New Hampshire. And I have a physical office. I treat my clients.
Do you ever work with people over the phone?
I do phone consults.
Yeah.
I do offer complimentary phone consults, 15 to 30 minutes depending on the needs of the client.
Yeah.
Because a lot of patients that reach out to me, either through their physicians or through a family friend or through word of mouth, they don't know what a pelvic health specialist does.
Yeah.
So the big question I get is, well, my doctor said that I should come and see you, but I don't know what you do. Yeah. So I go over the whole process with them and explain to them, who am I?
Yeah.
What do I do? What can I treat? How do I do my assessment and treatment? And then let the client make the decision if that is something that they want to pursue. I am looking into offering in-person consults as well, in starting maybe August or September, because I'm a big believer that getting face-to-face with someone is more beneficial than on the phone, because I think some of the messages can get lost when you're on the phone.
Yeah. So, so that's where they would come to see you. But that's nice that you do that, like preliminary sort of discovery call and an educational call to help people get started.
Yes.
So when people have, for all those reasons, I mean, I really hadn't thought about children and thought about men. Like there are a lot of people, a lot of men have prostate issues, either BPH, prostatic hypertrophy, benign, or cancer, and issues around that, or they've had cancer treatment, had prostate removed. So those are areas where you can help with gentlemen.
Yes. So as far as men go, men can get constipated too. The biggest message is that men have pelvic floors too.
Yeah, yeah.
Okay. Men can have incontinence, fecal and urinary. Men can have pelvic pain. Men can have constipation. So whatever can go wrong in a woman's body can go wrong in a man's body, minus the giving childbirth portion of it. And I'm just going to step back and just go over the brief anatomy of what I do. So the bony pelvis is
Are we talking about men, women,
both.
or both? Okay.
Both.
All right.
So the bony pelvis is right there, and then in the bony pelvis there
I wish we had a skeleton.
I did want to bring it in, but I'm like, you know what? I don't want to make it too technical.
Okay, go ahead.
So the bony pelvis, this is the imaginary bony pelvis, and the muscles are right there. They're hammock-shaped muscles, and they're called the pelvic floor muscles.
Yeah.
And these muscles have 5 functions. So the first function is supporting the organs. So in a man's body, it's going to be the bladder,
Yeah.
the walnut-shaped prostate,
Yeah.
and behind it is the rectum.
Yeah.
In a woman's body, there is a bladder, the uterus, and then the rectum.
Yeah.
Okay. So the first function is supporting the organs. The second function is sphincteric control, so that you don't leak urine and you don't leak stool.
So just to describe sphincter, what you mean by that is?
Sphincter is the opening.
Yeah.
Okay, so the muscles provide work to close and open the openings for both urine and stool.
Okay, so the sphincter, the opening itself isn't a muscle. It's the muscles.
Yes, it is.
Oh, it is. Okay.
Yes, the urinary sphincter is actually part of the pelvic floor muscles.
It's part of the muscle. So
Yeah.
it can be strengthened like this?
Yes.
Okay.
Yes. And then the third function is sexual appreciation, because all our genitals are in the pelvic region. Because of the sexual function, there is a lot of blood circulation in the area. So these muscles act like a sump pump with sexual activity. So that's the fourth function. And the last function of the pelvic floor muscles is the pelvic floor muscles work with your abdominal muscles, with your hip muscles, with your back muscles to provide stability. Okay? When people talk about core muscles, oh, I want to have a strong core. It's not just the sit-ups and it's not just the crunches. It's your diaphragm, which is the breathing muscle. It's your hip muscles. It's your pelvic floor muscles. It's your back muscles. It's the whole complex of the core that works together. And the pelvic floor muscles play a role in providing core stability. And these muscles can become either overactive, meaning they have too much tension in them, or they can become underactive, meaning they don't have enough tone, meaning they become weak.
Yeah.
So some people who have overactive pelvic floor muscles will have symptoms of urgency, urinary urgency, frequency, incomplete emptying of bowel and bladder, pelvic pain, and then people who have underactive pelvic floor muscles will have incontinence, laxity, and the organs are coming out of the vaginal opening. They can have fecal incontinence. Both the overactive and underactive muscles can cause pelvic pain depending on how the other systems are working. And so part of what I do is I help people, again, they come in and they say, oh, I have urinary incontinence. I determine what it is that's causing that urinary incontinence, because Kegels are not for everybody.
That's the only thing that you hear when you go for a doctor,
Yes.
generally Kegels.
Yes.
One of the things I've learned about you that makes me even more excited about sending people to you is that you really see people as a whole person. You're really you're doing a lot of listening and finding out a special program just for me, because there's no other person that has all my issues, including food, because I know that you're also a coach.
Yes.
And that you're working holistically with people that way, and you've brought even functional nutrition into. Can you tell a little bit about that?
So I am a women's health coach, and one of my specialties is lifestyle modification and functional nutrition and pelvic pain. Diet plays a huge role in a person's overall well-being. The inflammations that some of the foods can cause can affect the way you feel and how your pelvic pain comes up. Some of the examples are IBS clients, endometriosis clients, PCOS clients, a lot of pelvic pain where, oh my God, I had a hysterectomy and now I'm in so much pain. I can't even tell you how much it hurts. So I can treat the muscles and the bones till the cows come home. But if I don't treat the person as a whole, if I don't look at their lifestyle and go, okay, well, what are you eating? Or what is your bowel habit like? Or, are there any stressors that you want to discuss? Like, what is it that's your life is like? One thing that I'll say is when clients come to see me, a lot of clients don't know me. I don't know them. And I treat a very intimate part of their body. And so one thing that I'll say to everybody is when you come to see me, or, when a client comes to see a pelvic health specialist, the client isn't in charge. I'm not in charge, you're in charge. You're going to direct your care. No pain, no gain theory stays outside my office door. I don't believe in that. I also say to clients, any assessment, treatment, whether it be internal or external, that I perform on you, if you don't like it, if it makes you uncomfortable, if it brings back some old memories, you just have to ask me to stop. And I stop, and I don't ask any questions, and we won't do that again. Or if somebody comes in and they says, well, last week I saw you and I was in so much pain, and I don't know if that's expected. My response 95% of the time is, what, let's try and modify what we're going to do. Because I don't want clients to feel afraid to come walk into my door the next time when they come to see me, because then they're not going to have the result or the outcome that they're looking for, because their brain is so afraid that, oh great. Now I have to go and see her again. And the last time I saw her, she caused so much. I don't have like that. And I think when people hear that, they go,
yeah, yeah.
Because they've been told, the traditional medical community says, oh, it's fine. If it hurts, it's okay. It's going to get better. If I can't make you better, I cannot make you worse. That's not my goal.
It's interesting because, again, it's the whole person, and what I see you doing is creating a safe space first, because you're doing physically intimate things with people, talking about physically intimate, potentially embarrassing things. You brought up maybe even triggering painful memories, because we hear this a lot. People have had abuse in their lives or other things, or they may be having some dysfunction in their marriage, and it's just really hard to talk about. And as a nurse, it's always, hi, how you doing? Did you poop today? Like I talk about all those things and people get used to it, but it takes a while, and there's certain things people presume that they're going to talk about with you because they have an idea of what a pelvic floor therapy person would do. But so I really love that putting the client in control and creating some teamwork there. But you say stop, you say go.
Right,
Yeah.
and that's the basic thing, and I can't tell you over the years how many clients appreciate that, because a lot of chronic pelvic pain that I see is, they've seen more than at least 5 providers, if not more, whether it be doctors or PTs or nurses or, and they come in and they go, oh, so you don't want me to do that? And I'm like, nope, if you don't want to do it, we don't have to do it.
It reminds me too of when I pick people to give me massage. The ones I like the best are the ones that don't just treat me like a piece of meat on the table, that they ask me what I want, how does that feel, is this okay? They ask my permission, and we move along. So it becomes, it becomes very smooth that way. So
Yes.
I love that about you. The other thing though I'm wondering is, eventually are you able to establish a relationship where you kind of push a little bit to help people get there?
So clients will, it takes me two visits, and then they go, okay, you know what, you asked me that question and I said no to that on visit 1. I think I'm ready to talk about that.
Okay.
Or I'm ready for you to do that to me now.
Okay.
Or so part of it is, I do an online intake form. So they fill it out before they come to see me. So before they walk into my door, I have everything written down.
Yeah, yeah.
I treat in a private treatment room. The only thing I have is a desk and a chair and a mat. That's all I need. And I go over the history with them again, because I say to them, I want to hear your story. I want to hear your story from your mouth. And oh, it's a long story. I have all the time in the world. And I try to give them that non-judgmental space. And people will say, oh, this is really embarrassing. I'm like, try me. There's nothing I haven't heard. Try me, and we'll go from there. And then part of my intake and part of my initial eval is doing some assessment. So because I'm a PT, I do a pelvic girdle assessment. So I look at the stability, I look at the alignment.
So when they're in that space, you said you have a desk, a chair, a mat on the floor?
Nope, I have a massage table.
A massage table.
I have a
okay.
massage table. So I have them check them out first in standing position, fully clothed.
Okay.
And I go, okay, well, let's look at your alignment, because if the alignment is off, the muscles are not going to function optimally.
Yeah, yeah.
Okay? And I try not to make a comment like, oh, I've never seen somebody's pelvis so twisted. That's not a nice thing to say.
Yeah.
So I just say, oh, I think this side is a little higher. And they go, oh, is that bad? And I'm like, I don't know.
Yeah.
Maybe you've been this way for a long time. Is it going to get perfect? I don't know.
Yeah, yeah.
But the goal is for you to get functional.
Yeah.
As functional as
So
we
you're
can.
looking to notice things and then
I make an observation.
make an observation.
I
Yeah,
make
no
an observation.
judgment.
No
Yeah.
judgment.
Yeah.
And I walk them through it. And I go, okay, so this is what we did. Now let's take a look at your hip range of motion. Let's take a look at your abdominal wall. So I have them lay down on that massage table and I palpate their abdominal wall.
Yeah, they're still fully clothed.
They can be fully clothed. I
Yeah.
just have them lift their shirt up if they're okay with it.
Yeah.
Okay. And I go through the path of the colon.
Yeah.
I find where the bladder is in the lower pelvic region, palpate the bladder. I've done some myofascial and visceral training, so I use that technique. I can, if they're coming in for bowel issues, and if there is some stool, I can find the stool and I can teach them how to manage it at home. I love working on abdominal incisions, whether it be a cholecystectomy, or gallbladder removal, or C-section scar, prostate, laparoscopic scars, any of that. I love to poke, and they go, oh, I didn't know that was tender. And then I ask them if they want me to do an internal exam or not. And some people will go, you know what, just go for it, because I really want to know what it is. And some people will say, do we have to do that today? And I go, nope, we're going to talk about other things. And there is plenty of education that I can do to visit one that they can take home with and come back the next week and go, okay, I tried this, and this worked. But say if somebody comes in and they goes, you know what, I want to go ahead and do an exam. So I step out of the room and I give them some privacy so they can change from bottom down, including their underwear. They cover themselves up with the sheet, and then I come back into the room. And then I do an external assessment, so an external perineal assessment. So I go and find their adductor muscles, which are the inner thigh muscles, and I poke around there and see if there is any tightness or tension there. I have them work that pelvic floor muscle. So I tell them, can you squeeze your pelvic floor muscles? If it's a woman, most women know what a Kegel exercise is. So I say, can you do a Kegel exercise? 40% of the women do it incorrectly. Okay, when I ask them to squeeze, they're bearing down. Okay, so I look at the muscle excursion. Is the muscle shortening? Is it lengthening? And is it then bulging out? Okay, so we check that out. I look at the skin integrity. How does the skin look? If it's a postpartum mother who's feeding the baby, if it's a menopausal woman, if it's a perimenopausal person, if it's somebody who has chronic yeast or chronic vaginal infections, I look at the skin and I make, again, observations. I have a mirror. I ask them, do you want to look? And some will go, oh,
I've never looked.
and some will say, absolutely, I want to know. And then if some people don't know their anatomy, so I do an anatomy 101 and go, okay, this is the clitoris.
Isn't that amazing?
It is amazing.
Yeah.
And you know what I find, Joyce, is the 18, 19-year-olds are the clueless ones.
The clueless ones? Really? I would think with YouTube they'd know this stuff.
No.
Yeah.
No.
That's amazing.
Yep. And then I say, okay, do you give me permission to do an internal exam? Every step is done very clinically, very professionally, and again, the patient is in charge. And I tell them, anywhere I touch, this is where my hand is going to go. This is how you should feel. If it feels uncomfortable, please let me know. And I'm standing, so I can look at their face directly. And I go by their facial expression, because some will go, and I'm like, yeah, no, I don't think so.
Yeah.
And then I take a gloved, lubricated finger and I do an internal vaginal exam. For male patients, sometimes I can do a rectal exam, but nobody likes a finger up their butt.
Yeah.
It's not very comfortable, okay? And so I'll say to clients, you know, I know how to do an exam. I know how to treat rectally and assess rectally. Does everybody need a rectal exam? No. Some people benefit from it, and when the time is right, I will do it if they are okay with it. But my approach is very external to internal. So I start treating externally. And again, I think that helps create that space, that confidence between the provider and the client, where they go, okay, well, she's treated me externally and I haven't flared up and I'm going in the right direction. Maybe if she does an internal, that's going to help me too. Instead of, you know, there are PTs everywhere in New England that will say, oh, well, part of doing the initial eval is doing an internal exam. And I always say, if a woman says, well, any vaginal penetration hurts me, I'm not sticking my finger there. You're already hurting.
Yeah.
And they
You're
go,
on your patient's time, not your time, and that's just
Right.
there's no one like you.
and I have the beauty, I have the luxury of giving my evaluations are hour to hour and 15 minutes.
I was going to ask how long things take
Yeah.
for the initial. Now, what about follow-up? What about
Follow-ups are half an hour. No,
Okay.
follow-ups are an hour too. But say if I have a postpartum mother who is doing her exercises at home and she just needs to come in every few weeks for a quick okay, rundown of the exercises. I do offer half an hour sessions.
Got it. Okay.
At some point, I do want to offer telehealth. It's a tricky place to navigate because of legalities and across the border scope of practice is changing. So I'm still trying to figure out the regulations of telehealth in the area.
But that's a place where your coaching may be able to be applied.
Yes.
Yeah.
Yes. But again,
that's
it's a
good.
fine line with the whole PT license that I have. So I have to stay under the coaching and not do the PT part.
Right.
But anyway, so back to the exam. So we do an exam, we look at the pelvic floor muscles, I palpate them, I touch them, I go, okay, does it hurt? Is it painful? Is it tight? Is it tender? Can you squeeze? Is right side equal to the left side? How does it feel? I check for pelvic organ prolapse. And then based on what I find, I make recommendations. So if they have overactive muscles, we work on down training or relaxing those muscles. And if they are underactive, then we work on strengthening the muscles. But again, every client is different. I've seen clients who will have one side tighter and the other side stronger. First, we have to loosen the tighter side and then strengthen it. Okay, if you have a tight biceps, you're not going to strengthen your biceps like this. You have to lengthen that biceps and then do a nice.
And it can be many things too.
It can be many things.
It can be a combination of the exercise itself. It could be stress. It could be inflammation.
Right. You know what I tell people is it's like an onion.
Yeah.
And I'm peeling layers of onion.
Yeah.
One layer at a time.
Yeah.
Some clients I'll see them every week, the pain clients.
Yeah.
Some clients I'll see once in 2 weeks, once in 3 weeks, depending on what their needs are. Again, the client is at the center. I'm not going to have somebody come and see me just because I want them to come in. There has to be a need. For them to be in the clinic.
It seems we're getting low on time. I just want to give you a heads up on that because I have a question I want to ask you at the end that I always ask my guests. But it seems that with some fairly short time, you're able to really make a huge change in a person's life and give them back some function, some dignity, some really important things. I just have never met anybody like you.
Thank you.
You are so incredibly thorough, so holistically, your approach is holistic and very respectful of people. You're just an amazing person.
I think, and again, I'm going to say one last thing is the other thing that helps my clients is when I went for my training for all of this, they have classes they're 3-day classes, and there are levels of classes. So the first class is just learning how to do an exam. The second one is pain, and then it's bowel. When I go to a class like that, it's 3 days of internal exams, and we practice on each other. So I've had rectal exams done on myself, vaginal exams, and I tell my clients, I wouldn't do any assessment and treatment that I haven't done on myself. Trust me, I've been there. And when they hear that, they go, oh, is that how you got trained? Yes, I did. And that just takes that edge off.
That's really good. But
Yeah.
you as a person in general. So what I always ask my guests at the end of the show, because we have about a minute left, is what are the top 3 things it takes for you to be totally well? Just to tie into the name of our show.
So for
your
me,
life,
I have become very aware of my diet. I've done this with exercising, and I think in the last few months I've gotten to a stage where I keep very short-term goals. 20 minutes of exercise, that's all I need. And I do what I can. And if I can't do it, I don't go crazy because the stress doesn't help. And then the last thing I do is I'm trying to work smarter and not harder so I can spend more time with my family.
Oh, I love that one.
And have quality time with my kids.
I love that. I love you. You're awesome.
you.
You're awesome. Thank you for coming today
You're very
and sharing.
welcome.
I feel like we could have another whole hour just to go into some more detail of this, but I've got such a warm feeling about you, and I know that there's a huge need out there for the work that you do.
Thank you, Joyce. Yeah, it was my pleasure. Thank you very much.
You're welcome.